Welcome to this video for clinical skills. The first video is called History Taking. This is for Emirates Medical Center and both for residents and nurses. So this first video will be about history taking, and the following are our learning outcomes. Because in this video, we will discuss the cycle of a consultation, basic consultation skills, how to get an adequate history, and we'll revisit the sample technique. So first of all, the cycle of a consultation. There's a couple of phases in a consultation that you typically follow, which is called the consultation model. And this is a rather organized way of having your conversation. Of course, in practice, this doesn't always imply that you have to always follow these exact steps. You can differ from it. But for now, I will just explain how a consultation typically works. And the scope of this video is phases 1, 2, and 3, establishing contact, exploring the care request and main health issue, and history taking. First, a bit about establishing contact. What you typically do before treating a patient, or before talking to a patient, is reading the patient file. This is not always possible, but sometimes it is. Sometimes you do get briefed about the patient before you see the patient, so it's important to pay attention, and perhaps take some notes. It's also important to prepare some background information on your patient. And with that, I don't mean about the patient themselves, but I mean about their condition. For example, if the patient is a 40-year-old woman who complains of a swollen neck and fatigue and weight gain, you might be thinking about, for example, a thyroid disease. So you could look into that and perhaps prepare a bit about that in case the patient does turn out to have such a disease. And then when you actually see the patient, it's important you introduce yourself. This might sound very redundant to say, but residents and nurses alike are often inclined to first say, "Hi, welcome to Emirates, how can I help you?" before introducing themselves, actually. You're dealing with a patient, which is another human being, and the other human being would like to know who you are, so introduce yourself. And there's a couple of different opening lines that you could use. We're going to discuss a couple of them and see what the positive and perhaps negative aspects of using these lines. First is, why are you here? Well, that sounds a bit like a charged question, right? So if you say, why are you here? It sounds as if you're not expecting the patient there, or as if you don't want them to be there. So that's perhaps negative. Although it, of course, does invite to some extent the patient to talk about why they actually are there. So why did you come? Then there's, what can I help you with? Which at face value sounds like a good sentence to say, but you should note that what can I help you with might insinuate that you are the one who has to help the patient, and that it's a one-way situation where the doctor knows everything and the patient doesn't know anything. You kind of want to avoid that. Then there's, what's the problem? Or what's the problem? Or what's the disease? Or anything of that extent. So the problem with this opening line is, well, what's the problem? Well, patients often don't know yet whether they actually have a problem or not. They are often just concerned, or they're asking for your help, or they have a health question. To those patients, you don't just say, what's the problem? You want to phrase it differently, because there's not always a direct problem visible. So the last sentence, can you tell me what you've come to see me about, is perhaps the best of all of these worlds. Can you tell me? It's perhaps a bit of a closed question, yes or no, but people will often say, yes, I can, and then they go on to elaborate. So what you have come to see me about. That's important, because you, first of all, lie the responsibility with your patient. Well, it's you who came to see me, but it's also specifically me. And what is it about? So you're not asking what their problem is, or how you can help, or why they're there. You're asking, what have you come to see me about? Perhaps there's a concern of a patient, perhaps there's a symptom, perhaps it's a checkup, who knows? And that's where we come to the most important question that you can ask yourself. Why has this patient come to me now with this complaint? So your why is always the first question you ask. So what have you come to see me about? Or can you explain what you've come to see me about? This patient refers to their personalia, so their age, gender, and other characteristics of their person. as well as their medical history. So perhaps it's a type 2 diabetic, perhaps it's an obese patient, perhaps they have kidney problems, perhaps they have thyroid problems, anything of that sort. Then there's the me, which is the doctor. Well, why would people go to the doctor? People would only do that if they are worried that there's something wrong with their health. Because if they're not worried about their health, they're not going to go to a doctor. So there's the fact that they're coming to you means that there is a sense of there being something wrong. And you should always take that into account. And therefore, you should not be reluctant with the patient, and you shouldn't assume that the patient has come for something trivial. Then there's the now, so the timeline. For example, why did they come now and not a week earlier? And you can assume that it's not a result of scheduling issues. So it's not the result of a physician assistant that has a very bad agenda, or it's you with a very full agenda. For example, if the patient says, well, I've been having these complaints for a year, you could ask yourself, okay, so the patient has been having this symptoms for a year, but why did the patient come now? And that's something you can directly ask them. Okay, so you've had these symptoms for a year. Why did you come to me now and not a year ago? And finally, this complaint. So you talk about the complaints that they're having about their health or about their situation. You look for different signs and symptoms, so you explore their health requests, which we'll discuss later, but also their worries. So what are they actually worried about? Is there something that they think they might have? Are there any worries that you can perhaps take away? So then we, of course, come to exploring the care request. Now, during the introduction to residency or nursing video, we already discussed Socrates and OPQRS2, which are both methods that you can employ to explore the care request adequately. You can, you typically use these for pain symptoms, but you can still make use of all of them in case of other symptoms. So you can use the Socrates or the OPQRSU, for example, for a fever or an abdominal distress, or for a bruise. You just cannot ask all questions, or you might have to rephrase your questions a bit. So it's important to at least ask open questions. And if you think that your patient is very vague, you can make matters more specific. Your tone should also be inviting. Remember that the patient has already overcome a couple of barriers. Namely, first of all, the barrier of them thinking that they might have something. And secondly, the barrier of calling you or your physician assistant. So those are two barriers that they've already overcome. They might be pretty tired from those barriers. And then there's you, the doctor, who doesn't even want to listen. Well, that must be very stressful for a patient. So therefore, be inviting, also with your words. Now, when a patient has a vague complaint that you want to make more specific, such as, I'm very worried, you can ask them a follow-up questions like, what are you worried about? Or why are you worried? When they ask, when they say, I feel very fatigued, you can ask, is there anything that makes you tired? Or why do you think you feel this way? Patients can say, I feel sad a lot, or I feel sad about my situation. Then you can ask what you think about in these situations, or what do you do in these situations? And you can also ask for a social network. So is there anyone that you can talk with or discuss your condition with? And when a patient says, I have a lot of pain, you can ask them, for example, have you tried certain medications? Have you tried dealing with this? How do you cope with the pain or the sadness that you're having right now? And has this worked for you? Is there anything I can help you with according to you? And lastly, there's to show empathy. So that's a reflection of feelings. Over here, we have an example case in which we will try out all of these different things. So there's the example case of a 40-year-old woman with a history of hypertension who presents to her family physician. She's started to see a bit blurry and feels like she has to drink and urinate more often than usually. The patient is obese with a BMI of 31 and has poorly controlled hypertension. What kind of questions could you ask? Pause the video and write the questions down. So these are some of the questions that I had in mind. Like, when did you first notice the blurry vision? Do you wear glasses, or does any in your family? When does the blurriness occur? Are you still able to drive, work, and do daily things with this blurred vision? How often do you urinate? And does this bother you that you have to urinate so much? Do you have to urinate during the night as well? How much do you tend to drink? And how worried are you about your complaints? Some other useful tips are to paraphrase the patient, which you can also see as presenting the case. So after you have discussed a couple of items with your patient, you should give a brief summary of everything that was mentioned and end with, did I include everything? Is there anything that I forgot? Or is there anything that you want to add? Always, so the first two questions, it's did I include everything? Is there anything I forgot? Always blame yourself for forgetting things instead of blaming the other person for being unclear. Because if the other person is unclear, you should have asked them to describe better. By asking them anything you want to add, if there's anything you want to add, you're inviting the patient to join the conversation. Showing empathy is by reflection of feelings of the patient. So how do you feel about this now? What do you think about your diagnosis? It must be really difficult for you to feel like this, and you must feel very distraught or stressed or angry. And have the patient let out their emotions. And lastly, make notes. So report the patient data into the iPad or on the chart. The extended history, which is also part of history taking, should include your medical history. So all medical conditions that a patient has had that are in their file. And you can also ask them for medication use, management of disease, and allergies as well. I've experienced patient cases before where if you ask the patient, do you have any medical conditions? They'll say, no, I'm perfectly fine. But then when you look into the computer and you look for their medication use, they use antihypertensives, kidney medication, they use heart medication, anti-epileptics, they use everything. They have such a cocktail of pills. And then when you ask them about it, they say, oh, well, yeah, but my blood pressure is fine now. So there might be that misunderstanding in your case as well. So also always ask them for what medications they use, how the management of their disease is going, such as the hypertension. How is it going with your hypertension? And also inform allergies. Also, before prescribing a medication that's hyperallergenic, so such as penicillin, always ask them if they are allergic for penicillin. Family history is also important. So these are conditions that are present in the family. This is not only for genetic conditions, but also for behavioral issues, such as obesity. Obesity is to some extent genetic, for about 6 to 10 kilograms, which is, I think, about 14 to 22 pounds. But obesity is also very behavioral. If your parents have a bad habit of bad eating and low to no exercise, then you may also be not be eating healthily and not exercising a lot. Then finally, there's the social history, so the occupation, education, social life, support network, and personal life of the patient. And what to do in emergency patients? Well, of course, you cannot do this entire routine in case of emergency patients because you don't have all the time of the world. So for that, I advise to use the sample system, which was also discussed in the introduction video of nursing and residency. So in this video, we discussed the cycle of a consultation, basic consultation skills, how to get an adequate history, and the sample technique a little bit. So thank you for watching. If you have any questions, feel free to contact us on Discord, and we hope you enjoyed.